Welcome back, everybody. And I'd now like to move on to our final speaker, who is Dr. Martin Hyde, an Associate Professor at Swansea University, who is going to talk to us about the impact of COVID-19 on the working lives of older adults in the UK. So over to you, Martin.
Thank you very much, Jill, and everyone for staying around for the talk. I see that most people have been able to stay, though quite fittingly, a number of people have had to dash off for other meetings, which I think is now part of the new normal of working life, as the previous speaker said. And that really ties in with what I want to talk to you about just before we sort of get to the wrap up for the conference, which is that, as we've seen over the last 2 days, COVID has had a massive impact across a whole range of aspects of our day-to-day living. And one of the key areas that it has impacted on is obviously our working lives. Two huge transformations, I think, are occurring. One is the amount of people who are working from home, or those working in certain types of occupations who are unable to work from home, having been furloughed, has led to an incredibly disruptive pattern of working life over the last 12 months. And there are some concerns that both older and younger workers have been particularly disadvantaged as a result of this, and that they are now being pushed out of work and will have difficulties finding re-employment and maybe even leaving through early retirement. For those of us who are able to return to work, it looks like the world of work will change for a great number of us. Some companies are even talking about moving entirely to remote working, whereas others are talking about more hybrid type working relationships, where more and more of it will be done remotely through various technological fixes. So I think COVID, as a number of speakers have said, will have a long-term effect on the way in which we work. And that's really what I've been interested in trying to look at over the last few months. So we see from these figures that have come from the Department for Work and Pensions that an incredible 11.2 million jobs across 1.3 million employers in the UK have been furloughed. So the scale of the disruption that COVID has inflicted on people's working lives has been, I would say, unprecedented, at least since the Great Depression of the sort of 1930s. So the long-term effects of this are going to be felt for generations, as one of the other speakers said. So what I want to do really is look at the two parts of this change. One is to look at the experience of older workers who have been working from home. And then one is to look at the impact that employment disruptions have had on retirement plans. And for me, these are two very important issues, not just because of the magnitude of the changes that people have experienced, but because, on the one hand, whilst there is research on working from home, most of that has been conducted with younger adults, particularly new mothers. And there's relatively little that's looked at the experience of older workers working from home. And I think there's reason to suspect that they might have different experiences. Also, there is quite a bit of research that shows that involuntary retirement is associated with poorer health and well-being outcomes, and a smaller but growing amount of research that says that involuntary extended working lives are also associated with poorer health outcomes as well. So the extent to which people feel that they are forced to change their retirement plans could impact on their health and well-being in retirement. So I've used two bits of information for this. This is going to be quite a statistical presentation. I'm going to show some tables and charts. To answer the first part of the presentation, a colleague and me did an online survey just to sort of capture people's experiences as it was happening. So these are from, effectively all around the world, although predominantly from the UK. And we had a reasonable response. About 110 people got back to us about that, so we can explore some of those issues. And our hope is that we can use those data to build a more comprehensive grant application to undertake a better research on this. And then the other part of the presentation draws on some nationally representative data, although unfortunately, because we don't yet have a longitudinal study of aging in Wales, these data are from across the border in England and based on the sub-study from the English longitudinal study of aging. We have around about 8,000 people who responded to this study to tell us, or to tell the research team, what their experience was after the first few months of the coronavirus pandemic. So first, if we look at the online survey that Aylwin and I did, we asked a range of questions about people's experience of working from home. And reassuringly, most people had sort of positive experiences. So if you look at really the sort of blue and the red parts of the bars here, we see that most people said that they had some kind of dedicated working space from home. Luckily, most people didn't have any type of health condition that impacted on their ability to work from home. They seemed to have reasonable levels of control over the types of work they did, how they did it, and the pace at which they carried them out. So from this very small study, it seems that working from home had a number of positive effects, or at least they weren't overwhelmingly negative. At the same time, we find that although most of our respondents said their employer hadn't assessed the working conditions at home, they generally supported quite positive work employment policies. So they supported flexible working. They were conscious of people's care responsibilities. They did supply assistive technologies if people needed to when they were working from home. And they had working from home policies and guidelines. So I think people felt that they were quite generally well supported, but that more could be done. So when we asked people about what they felt their employer could do to make their working from home experience better, people were very high, or a high proportion of people said that it would be good if they had a more inclusive culture, so nobody felt disconnected from what was going on. Particularly some awareness, training about the needs of older workers beyond technology itself. I think this got to, but obviously some issues around technological use, and that's come up with some of the previous speakers. Again, clearly, despite the previous results that show most people felt that they were provided with some assistive technology, perhaps more, not assistive technologies, but more sort of day-to-day bits of kit that you need to be able to do your work in a kind of comfortable and productive way could have been provided. So a good PC, laptop, office desk, or kind of a good office chair for everybody, rather than just those with particular sort of care health needs. Again, awareness of maybe designing work better, particularly in terms of the flows of work, looking at people's home conditions, and then somewhat less than half of the sample talked about getting better access to occupational health and more flexible working arrangements, although we've seen from the previous slide that people felt that their employer generally did support that, and again provided ICT training. And again, it looks like most people felt they were pretty competent with their ICT skills to work from home. So we asked some open-ended questions as well about what people thought were good and bad aspects about working from home. And I think this certainly resonates with the previous speakers' talk, that people did find some positive aspects. Certainly the lack of commuting time, or time spent commuting, time spent not having to get, dressed up to go to meetings, allow people to be more productive, allow people to have better health, so not having to spend long times commuting standing up or driving to work, where people obviously were complaining of pain in joints. People feeling that they had more time to spend with family, friends, or in this case, to look after sick pets, so the opportunity to be more in control of their time from home, and also be more active, eat healthier lunches, practice mindfulness. So people did tell us that some working from home aspects have been good for them, but people also reported some negative aspects as well. So I think has already been mentioned, inconsistent internet connection, this lack of clear boundaries in your home and work life. People reported that missing that kind of face-to-face contact that other speakers have talked about. So those corridor conversations that people have, those sort of just being able to see people, either that's for work issues, just being able to catch up and have a quick chat about ideas, or the social side of work. Some people in managerial positions were worried that their teams were working too many hours, so they felt kind of concerned about their responsibility for their teammates in order to ensure that people weren't getting burnt out. And the opposite side here, where some people felt that working from home allowed them to take more active lifestyles, some people felt that the sheer volume of work they were expected to do now from working from home meant they didn't have time to working from home or sleeping from at work is exactly what somebody says here. That kind of decline of boundaries, and particularly maybe walking to and from work or walking around work, meant that they were putting on weight and felt less healthy because of that. And eye strain as well from constant video calls. I think the previous speaker mentioned that, and it's certainly something I know that I've suffered from during lockdown. In terms of the impact that this disruptive sort of work has had on people's retirement plans, we use these data, like I said, from the English longitudinal study of aging. And although we see that the majority of people didn't have to stop work because of COVID, still almost 1 in 4 people did. So I think that's quite a substantial amount of people. And again, even though the majority of people didn't change their retirement plans, around about 14% of people did. Which again, if you think about how long you spend planning for retirement, the fact that within a year, or in this case, really because the data were collected in the summer of last year, within a few months, people have started to think about planning, changing their retirement plan. So although it seems like a relatively small proportion, I think it's quite a radical change in people's life plans. In terms of whether stopping work impacted on people's retirement plans, so people were asked whether they plan to retire earlier, later or not. And I looked at that within that group that said they stopped work compared to that group that didn't stop work. You can see that those who stopped work were more likely to have changed their retirement plans, both in terms of planning to retire earlier, about twice as much, and slightly more who were planning now to retire later. So stopping work does appear to have impacted on people's retirement plans. The next question then is, well, who has had to stop work? And was that kind of even for everybody? And actually we see that it wasn't, that those in the higher socio-economic classes, so those occupations, not just where they get paid more, but they have more control, who are probably more able to work from home, jobs effectively like mine, where it's not essential for you to be in the office every day. These groups are less likely to have had to stop work because of COVID, whereas those in lower supervisory and technical occupations, particularly those jobs where you were sort of working in factories or doing sort of service work. So one of my neighbors works for a utilities company, and they were put on furlough, obviously because of the restrictions on meeting people. They were much more likely to have had to stop work because of COVID. And then the question is, well, how does the relationship between stopping work and retirement differ, or disruptive retirement plans differ for these social classes as well? And here we see a slightly different pattern. So whereas before those in the higher managerial groups were less likely to have stopped work, they're more likely than some of the other groups to have changed their retirement plans. So you can see about 10% of them now plan to retire later, about 6.5% plan to retire earlier. And the other group where we see high numbers or high proportion of people change their retirement plans are in that group that were also more likely to have stopped work. So that lower supervisory technical occupations. And again, about 1 in 10 and sort of, almost sort of 8.5% plan to retire later and earlier respectively. Whilst in some of those other occupations, relatively low proportions of people planning to retire. So there's sort of a bit of an interesting story going on here that stopping work doesn't seem necessarily to impact on changing retirement plans for different socioeconomic groups, because the patterns look slightly different. So I took the next step to sort of delve into that and say, well, are there socioeconomic differences in the relationship between stopping work and changing your retirement plans? And because I'm including these three variables, I wasn't able to look at whether people wanted to retire earlier or later, but just whether they changed their plans or not. But what we see is that in that top group, the higher managerial group, in that sort of middle group, self-employed, and in that lower semi-routine and routine occupations group, stopping work had a much more significant impact on changing their retirement plans compared to those who didn't stop work than in these other two groups. So if you were in a higher managerial occupation and you stopped work, and remember, you were much less likely to stop work in this group, you were much more likely to change your retirement plan. So about 1/5 of, so rather a quarter of those who stopped work in this group were likely to change their retirement plans. And based on the other side, we're probably more likely to want to retire later because of stopping work than those who didn't stop work. And again, if you go down to the routine and semi-routine group, we see 13% of those who stopped work were more likely to change their retirement plans compared to 6%. So almost, well, over twice the rate of amongst that group who stopped work who were likely to change their retirement plans. So there seems to be something going on about the type of occupation you had and whether stopping work impacted on your changes in retirement plans that didn't necessarily map onto the likelihood of stopping work. So it's quite a complex set of relationships. So these are very early analyses, like I said, just trying to capture what's gone on in those early few months. But in terms of working from home, the results seem to be quite positive. Most of the respondents didn't report any problems, and they did, in the open-ended questions, report some positive aspects. But others did highlight feelings of loneliness, this problem about the boundaries between work life and home life were an issue. So if companies are keen to extend this way of working, which a number of them seem to be keen to do so, then it's important that they find ways to address those issues to make sure that people's health and well-being aren't negatively impacted by being expected to work from home for longer. In terms of the impact on retirement plans, well, although the majority of people didn't experience a change in working conditions or retirement plans, I would say a significant minority have done. And it looks like disrupted employment impact on changing retirement plans. And that seems to be particularly the case for those at the two ends of the socioeconomic spectrum, as well as those in self-employment. So again, going forward, we need to make sure that there is targeted support for those groups in order to support them either to potentially find other jobs if that's what they want, or to think about how to sort of transition into retirement or work for longer when they weren't planning to do so prior to COVID. Because as I said, there is a significant amount of literature that does show that what we call these disrupted life courses or these disrupted biographies can have quite a negative impact on health and well-being because you're simply not prepared for these new realities. So, and your whole sort of set of planning, which obviously involves many other people in your lives, can be disrupted, which can lead to other sort of conflicts with employers or with partners or family members and friends who are also thinking about maybe basing their retirement decisions around yours or vice versa. So support needs to be provided, or guidance needs to be provided, to ensure that those people who do feel that their retirement plans have been disrupted by COVID aren't doubly disadvantaged by having a less rewarding retirement because of that. So I appreciate